Welcome to the new Cyber Frontier, bringing you the latest news and initiatives that focus on the development of cybersecurity economics. You don't have to be a computer or cybersecurity expert to get plugged in. Your host brings it straightforward, asks the tough questions, and brings the cyber world to a level of understanding for everyone. You can find us on the web at www.newcyberfrontier.com. Now join our host as he introduces the topic for today's New Cyber Frontier.
Welcome to today's episode of New Cyber Frontier. On today, we are continuing our series on IEEE blockchain and AI for healthcare. And today's guest, Gora Data, is one of the senior members of IEEE and sponsoring a lot of these talks. And but he is a academia and now into his own company, industry and academia kind of dividing, CEO of Cal to Cal, and also a visiting professor at University of California, Berkeley. Gora, welcome. Thanks for joining today.
Thank you very much, Chris. It's my honor to be part of the show. Thank you.
Definitely. So there's so much to say about you. It's better though you kind of give your background. A lot of what you see the efforts in this series and work with IEEE blockchain has been Gora, very positive force in engaging there with so many different areas. A whole series for a year you did every month of a speaker series. It was very, very well engaged with. But give us your background, how you got to where you're at, and where you expect things are heading.
Sure. Thank you, Chris, again for the opportunity. I do various things. I wear too many hats. But fundamentally, I'm a tech person, ICT, Information Communication Technology. That's the field I've been for the last 38 years. And as you mentioned earlier on, I'm the founding chairman and CEO of Cal to Cal Corporation, an ICT-based tech organization. Been around for 25 years, even though it feels like as if we started yesterday. Mm-hmm. And within my nearly 40 years of professional experience, I've worked, I'm based in the US, Southern California. This is where I've been for the last 33 years or so. But I've worked internationally, globally, across the various countries, across continents, or primarily in the ICT space. But in the recent past, for the last 20 plus years, I've specialized in digital health, digital tech, mobile health.
Do you have any kind of a healthcare background, or is it mostly just technical kind of bridging over?
It is technical bridging over. I don't have a healthcare background per se, but what is interesting is as life comes around a circle. So I'm an engineer by training and also a scientist. So I have a bachelor's degree in engineering and a master's in science. And one of the science project I did during graduation, this is interesting, is a 6-month project on computer-aided application in DNA sequencing. And this was way back in 1984. So maybe there was some sparkle of working in the health space was there, and it's come full circle for me. But otherwise, yes, it's really working with our clients over the years through a tech background, and especially in the last 20 years, I'm embedded in the healthcare industry.
Yeah, talk about that, the HL7, what it is, and your involvement there.
Right. So one of the things I do quite a bit, and especially for the last 15, 20 years, 20 plus years, is working in the standards space, and specifically in the digital health standards or digital health informatics standard space. So within that, there are a couple of standards bodies. So one of them being HL7.org, Health Level 7. And this is a standards organization, SDO, Standards Development Organization. And I wear a few hats there in that organization. I am the founding chair of its mobile health work group. In fact, it's about 9 years since we started that group. So it's been around for some time, where we are now developing standards in the mobile health space. I'm also on its Education Advisory Council. I'm one of its founding members, where we are looking into all things related to HL7 and education. But primarily, HL7 is a technical standards committee, which is developing standards. It's been around for about 25, 30 years, and it's developed standards in the health informatics space.
All right. We'll be right back. We're going to hear from our sponsors.
Blockframe Technology offers next-generation blockchain managed trust and security. Unique non-fungible tokens are used to secure software bills of materials to provide data quality and security for every transaction in your supply chain. Deploy advanced peer-to-peer product security, scale zero trust capability to millions of IoT devices, allow vendor tracking and accountability, and rapidly reset from compromise. Unchangeable, time-sequenced blockchain data provides next-generation security using machine learning trust algorithms and audit analytics. Start securing your supply chain today by contacting Blockframe at www.blockframetech.com.
Welcome back to New Cyber Frontier on Today with Gora Data. And before the break, we were talking about HL7, health standards, health records. And you mentioned mobile health.
Right.
Explain what that means. Is that like mobile applications? Is it all the IoT devices? What is mobile health?
Right. All of those. So anything, the world we live in today, this was quite a novelty 10 years ago when we started as a standards group. And if you sort of look back, it's only since 2008 or so when mobile technology became mainstream.
Mm-hmm.
Even though the mobile technology has been around for over around 20 years or so, but it's really in the last 12 years or so, since 2008 or so, it's become a mainstream stay with every person, young, adult, or mature seniors. Everybody has a mobile device.
Mm-hmm.
As I say, anything from 6-month-old baby with mom trying to keep the baby quiet, they hand them the phone, and they're looking at the cartoon to 80, 90-year-old. The entire spectrum is now completely dependent or uses technology for day to day. So this is what we are looking in from a healthcare perspective, is not only from a patient perspective, from a provider, from a payer, from a pharmacy, you name it, the application of mobile technology in access and care of health.
Okay. And the transmission between those HL7. Gotcha. A couple other standards. I mean, IEEE got there in your backdrop. We got connected through IEEE, and you work with ISO. Talk about the kind of how that fits into those as well.
Right. So IEEE is the world's largest, oldest, and largest professional organization. As I always fondly say, it's the Association of Geeks. It started many years ago, 1884, or somewhere at that time frame. But it's been over the last many years, especially the last 50 or 60 years, it has evolved and gone beyond being an Institute of Electrical and Electronic Engineering. And we don't use that expansion anymore. It's really IEEE. And it not only has technical folks from the electronics background, there are folks from the computing background, folks from the engineering side, from engineering in medicine and biology, and you name it, the entire spectrum. Within that, IEEE also has a standards group activity called IEEE Standards Association. So there are some roles I played there as well. One of our key initiatives is the IEEE Blockchain Initiative, amongst many other initiatives within the emerging tech umbrella, or what we call our future directions. And within the blockchain initiative, as you mentioned earlier on, I helped launch the IEEE Healthcare Blockchain and AI Virtual Series in the midst of pandemic in the middle of 2020. And yes, it's been about 15, 18 months where we have pulled off, which seemed quite impossible. How do we get people back to engage and converse, and especially in this field, emerging, growing field of blockchain and AI with respect to healthcare. And besides the IEEE Blockchain Initiative, I'm the co-chair of its conference and events for the IEEE Blockchain Initiative. Besides chairing the virtual series I mentioned, I also wear a few other hats within IEEE. I'm the chair of the Southern California Council. I'm also on the board of the Orange County section, and so on and so forth. So I'm deeply embedded and active volunteer of IEEE as well.
And what do you do with ISO?
Right. So ISO is the International Standards Organization. It's a global body affiliated with the UN at that level, where members of ISO are countries. It's an interesting organization where you and I cannot be members of it directly. Members are the countries, and then we can be the country representative. So I'm a US delegate to ISO, and within the ISO, there are different technical committees addressing different technical areas, So the committee I belong to is called ISO TC, for Technical Committee 215, a very geeky, and it's for health informatics.
Mm-hmm.
I'm part of, first of all, I'm a US delegate to ISO TC 215. And within the TC 215 technical committee, there are different work groups. So I'm the convener or the chair of one of the newly formed work group called Work Group 10, interestingly on traditional medicine. So you would wonder, where does traditional medicine fit in the healthcare paradigm? And that's exactly what we are trying to break, is that these are no longer silos. As patients, we may be taking the Western medicine, we may be taking the traditional medicine, but when we go and talk to a doctor, we don't mention what herbs we may have taken or what traditional medicine we may have taken, but it does impact our health. So we are trying to break that silo. So anyway, so within TC 215, I'm the convener, in fact, the founding convener of this particular work group.
Interesting. So now we step back to the topic, for today is emerging technologies, and we'll call it blockchain, AI, other emerging technologies. How do you see that cross section fitting in for healthcare in all these representative organizations? How do they all fit together?
Right. So it's a great question, because one of the mistakes I would say many times people make is when they talk about technology and they love their computing, quantum computing, or they love their blockchain, and that's all they talk about. But what is reality is, when you take these emerging technologies and apply to mainstream in terms of its use, in terms of solving a problem, we don't make a distinction as, this is this technology, therefore it has to be only that has to be used, or the technology does not exist by itself. It is working with other technologies. What we are trying to solve is not the technology, how to use it, but we're trying to solve the problem. Mm-hmm. So you don't pick a hammer of technology or a hammer of blockchain and use it for every problem you have. What you need to do is look at the problem. What is the best way to solve that, and what are the technology you need to bring together, whether it's blockchain, whether it's AI, and many a times they are interlinked. So it's really important to understand that emerging tech, and when I say emerging tech, I'm really talking about technologies which have come around, let's say, in the last 20 years or so, and they have transformed the world we live in. How we play, how we act, how we relax, how do we learn? It's all technology driven, and the emerging tech is a key part of that.
Okay, so one thing that I wanted to circle back around, and I know I might catch you off guard a little bit by this one, but I wanted to kind of prelude it and then give you some time to think about it, and we'll talk about it when we come back from the second sponsor break here. But this show's about cybersecurity, and privacy is a big piece of it, and purposely we went into all the different areas you're involved with, and when we come back from the break, I want to say where does security and privacy cover in all those areas? Where do you feel that they fit, and how much are they being addressed? Because from people always thinking about emerging tech and the positive use cases, so oftentimes we're like, oh yeah, cybersecurity will be a bolt-on afterwards. So I just kind of wanted to bring you into that discussion, but we're going to hear from our sponsors. We'll be right back in a minute.
Blockframe Technology offers next-generation blockchain managed trust and security. Unique non-fungible tokens are used to secure software bills of materials to provide data quality and security for every transaction in your supply chain. Deploy advanced peer-to-peer product security, scale zero trust capability to millions of IoT devices, allow vendor tracking and accountability, and rapidly reset from compromise. Unchangeable, time-sequenced blockchain data provides next-generation security using machine learning trust algorithms and audit analytics. Start securing your supply chain today by contacting Blockframe at www.blockframetech.com.
Welcome back to New Cyber Frontier. On today with Gora Data, who holds so many roles and standards. We're looking at emerging technology across the board in different places, and healthcare especially is the focus of this series. And we brought him back right before the break to security and privacy, the topics kind of that we focus on here the most. And I wanted to kind of get from somebody being that deep into all the international standards and what's going on with emerging technology. Where does security and privacy fit into you? How's that addressed?
Great, Chris. Fantastic question, and now it's my turn to surprise you. Of the many hats I wear, I'm also the founding chair of the IEEE Cybersecurity SIG for Southern California. So yes, this is a space I've been dabbling with for the last many years. In fact, given my technical background, professional background, I've been involved in networking for the last 35 plus years. And therefore, some of the cybersecurity challenges, which are completely based upon networking infrastructure, is a part and parcel of what my DNA is all about. But coming back to healthcare in particular, one of the areas I deal with on a regular basis, literally daily, are providers, whether they're outpatient providers, physician practices, or large hospitals. This is the world I live in. And now, if you think about small independent practices, these are the backbone of care delivery system in this country. One thing which I remind people is when you fall ill at this country, you don't go to the hospital, unless it's SOS kind of an emergency situation. You go to your friendly neighborhood doctor. In most cases, they are a small independent practice. And this is the world I live in on a day-to-day basis. And trust me, they have absolutely no knowledge of cybersecurity, and in fact are under the impression that this is something which will not impact them.
Mm-hmm.
So, and their general reaction is, oh, we are small, we have nothing, there's nothing, why will they come to us? They'll go after the big hospitals and they'll go after the big enterprises. So, we are too small. So as you can understand that even at that level, how vulnerable we are, how unprepared we are as a nation in terms of our preparedness for cybersecurity. That's one. The other thing is the bad guys have found this out. They know very well that we are very vulnerable in that space, number one. Number two is they've also figured out that our financial data, if stolen, can easily be changed in terms of you can cancel your credit card, you can cancel your bank account, but if your health record is stolen or altered, it's a lifelong impact on you. So therefore, in the dark web, your health record is 4 times is the selling price of your health record versus your financial record, 4 to 10 times. So depending on what it is. Why? For the simple reason, if you have a disease, if you have some health condition which you want to make sure it's your private information, but if it's out there, it's exposed. It's very, very difficult to change that. You can't say, "Oh, let me cancel my disease. I don't have that anymore." So the impact of that is much more than what we are thinking. So and this is something which doesn't impact only the big organizations, even though that's what gets the press, but it impacts these small provider groups. It impacts you and I as patients. And that's the other reaction I get from patients. I have nothing to hide. So, if they hack it, what will happen to me? Nothing. Well, you and I live in this world. We know what will happen. And
yeah.
So yes, this is a part and parcel of what we have to do. So anytime we talk about emerging tech, privacy, cybersecurity is integral.
How much of a focus on the HL7, ISO, and the IEEE groups do they put on security, privacy, and you're involved with?
Oh, very much so that there is a work group within HL7 just focusing on security. There's a work group within ISO TC215 just focusing on security. Absolutely. And not only at these groups, but then other standards as they are evolving. So one of the key aspects of the new standard HL7 has today called FHIR, FHIR, Fast Healthcare Interoperability Resources. A key part of that is security. So it is there across all the emerging standards. Absolutely.
Interesting. So thinking about emergency technology, and applying it in these areas. What does the future look like? Where are you putting blockchain, AI? Where are the things going to help the most with the individual patients, the doctors at that level you were talking about? Where do we start and where's it going from here?
Right. So this is a fascinating question, because this is something I talk about quite a bit, is the way we look at healthcare. If you look at the definition of healthcare, is, in fact, if you Google healthcare or look up what is healthcare, it's really care being provided by the provider to the patient. That is what is healthcare. Whether the provider it can be hospital, it can be pharmacy, it can be a lab, it can be an insurance system, but these are the healthcare providers who are providing care to you and I as patients. And my point is that this is going to change. It is changing on its head. That is, in the future, we will not have patient care, healthcare. We will have patient care.
Mm-hmm.
And what I'm really saying is, because of the emerging techs of blockchain and AI and 3D printing and AR, VR and AI ML, is it's going to turn on its dime the way we have seen the disruption take place in other industry sectors, transportation sector, hospitality sector. I'm talking about Airbnbs. I'm talking about Ubers of the world, how they have changed those industry. Healthcare also is going through the transformation, where instead of the healthcare providing care to the patient, the care receiver, I'm saying now the care receiver will be demanding or soliciting care from the healthcare provider. So you see, instead of the care giver giving it to the receiver, is the receiver getting it from the caregiver.
So you think this goes to like patients helping patients, or AI predicting and helping patients, and we really skip the doctor and we go distributed ledger with our healthcare? Is that what we're talking about?
Not necessarily that we skip the doctor, but what I'm saying is, today when you fall ill, tell me what you do when you and I we fall ill. We reach out to our doctor. We try to find out which doctor we need to go to if we don't have a primary care physician, right? What do you do today when you need a cab or something? You pick up a phone and Uber, and 5 cabs will say, "Oh, I want to service you." Mm-hmm. That is the change.
So you'll basically say, "I need service," and 10 doctors will be there to say which one of us would you take?
In a very simplistic manner, but yes, that is the change I'm seeing happening. And
so, do you think doctors quit having a set list of patients anymore, and it's just like whoever's online at the time can service whoever needs help at the time?
To some extent, yes. If you think about it, how we have sort of moved in the shopping area, right? Especially when you had to buy something in the olden days, many years back, you would go to the milk store, you would go to the egg store, you will go to the shoe store, and then all those went away. You had the supermarkets, you had the consolidation of the services, and you go to one place, and then you had all the services. And now what we are saying, okay, we go to Amazon and the goods come to us, or we go to some kind of a common intermediary. So we can see this change which has taken place. So in healthcare also, we would see similar changes coming very rapidly, where concepts like curbside medicine, which means...
Seems like, we went to micro providers. Everybody had their own family doctor, and then they go to megas with hospitals. It's almost like saying that distributed ledger and emerging technologies get us away from the micro providers to a commodity source pool of providers.
Right. And the question is why? Because of various reasons. One, we are a growing population. We are no longer 2 billion population worldwide. We are now touching 8 billion globally. And this has happened in less than 100 years. If you go back and see what our population was 100 years ago, I think around 4 billion or even less. Today, we are touching 8 billion. So right now, but we'll be soon 8 billion and increasing. So we have more people, but do we have as many doctors coming up? No. The statistics are, in fact, ever widening, and especially in many countries, developing countries, where we have lesser number of care providers compared to the population. So it's a gap which is not going to get filled up.
Yeah.
Second is, thanks to the advances in medicine, we are no longer dying at the age of 50s and 60s. There was a reason why retirement age was set at what it was set way back. Today, when we turn into our 50s or 60s, we start living. We live for next 20, 30, 40 years, depending on your lifespan. So we are living, we have more population, we are living longer, but our diseases haven't gone away. So we live longer, we live with our diseases, and because of the lifestyle we lead, our diseases are now starting in our teens or early teens. Look at the pre-diabetic, look at the obesity, all these things which would normally have people get there around their 50s and 60s, now in the teens or pre-teens they're getting it.
Mm-hmm.
All these are increasing impact on the cost of care. So this is where technology comes in. This is where enabling emerging techs come in. This is where I see the role of blockchain, AI, AR, VR, all these various emerging techs come into play.
Yeah. Do you see that, maybe even a prediction software will take the first run to see and tell us what we might have before a human even gets in the loop as a provider?
Okay, so let me tell you something not too many people know. I'm sure you have, Chris, you have drive through a fast food restaurant.
Mm-hmm.
Your favorite, whether it's McDonald's, In-N-Out Burger, or wherever, right? Or Wendy's, whatever it is. And if you're going to a drive-through, what are you doing? You're ordering on the board which is out there. There's a speaker. The person comes in. You place the order, and you go and pick up the food. Most people, almost all, don't recognize and realize that that is not necessarily always a human. Did you know that? Even though you
I
think
have
that's
noticed some of them are very consistent and could not be a person that chipper all the time.
right. So most people think, oh, there's somebody with the headset inside who's going to handing me the food. No, it is actually, and already we have in our system where these are human-like interactive system, voice recognition system, which is already interacting with you. So we are seeing the triaging. We are already seeing the impact of bots. We are already seeing the impact of CD and other such uh,
Mm-hmm.
solutions coming in. Even in my household, how do turning off the lights before you go to bed? You no longer need to get out. You say, hey Google, turn off that light, or hey Siri. Our driving, there's no human there. All our GPS devices. So we are already seeing that. So we are seeing the transformation come in. So it's really the level of sophistication. The technology will do the initial level of filtering, interfacing, triaging,
Mm-hmm.
and then we will have the higher level and next level of intervention.
So how do you see that the federal or public healthcare programs would fit into this? Take some of these roles. Where do you see that?
Right. So there are a couple of things happening here as well. So on one hand, we are seeing the impact of technology or the potential impact of technology in some cases. Right. On the other hand, we are also seeing a very, very widening digital gap, which is
Mm-hmm.
taking. Why? For very interesting reasons. That all these emerging techs that we are talking about have come about, let's say, in the last 20 years or so, very aggressive. Some may be a little older, but let's say in the last 20 years, most of them have come around. And whereas if you look at our educational system in any country, including our country, our educational system are structured in such a way that the folks who are teaching you were themselves trained over 20, 30 years ago. So you have a system where somebody's teaching you about knowledge which they themselves were not trained on,
Mm-hmm.
because these innovations have come in the last 15 to 20 years. So you're seeing a skills gap. That's on one hand. Second is the whole adoption of technology and mobile technology. You name any kid, a 2-year, this is what I say, take any 2-year-old child across the globe, doesn't matter who their parents are, they may not be able to speak their own mother tongue, but they know how to play with dad and mom's cell phone.
Mm-hmm.
Right? It doesn't matter how rich, how poor, which country, economic status doesn't matter. A 2-year-old kid knows how to play with dad and mom's phone, and every dad and mom tries their best not to give them that. but they know it. So we are ingrained, we are wired as future generation to leverage technology and use.
Mm-hmm.
So therefore, all the services which are coming through now in the future, whether coming from the federal system or private system, has to recognize that our future generation is much more adaptive, and therefore their vision, their view, their need, their expectation are very different than what the previous generation was. And one of the areas you spoke about privacy. No, what is privacy for you and I is very different than what is privacy for the young generation.
Mm-hmm.
So yes, so as far as systems and emerging systems which are coming through in the future, first of all, this skills gap which I'm talking about, that needs to be changed. It is being recognized now. COVID really threw the spotlight on that how ill-prepared we were as a nation. In fact, the entire world was ill-prepared when COVID came. And it was really technology which had to fast track because suddenly we stopped going anywhere, right? We were all at home. But the life had to go on. The service had to be provided. What came to rescue was the mobile technologies and the connections.
Mm-hmm.
So we are seeing that adoption, we are seeing that change and recognition that we need to mitigate the skills gap. We need to upskill our working professional, and we need to reskill or new skill our young generation.
All right. Well, that's a good closing, except for I wanted you to kind of reach out to our audience and tell any way they can get involved with you, connect with you, any customers or whatever that you might need to engage with you or looking for, anything you'd like to get out to our audience.
Sure. On a personal level, you have my name, and if you do a LinkedIn search with me, you will be able to find me. That's on a public forum. But if you are interested in being involved in any of the standards organization I mentioned, HL7, IEEE, or ISO TC215, these are organizations which are also always actively looking for volunteers. These are all volunteer-driven organizations. So all the work is being done by volunteers like you and I. And if you have the passion, the desire to change, the desire to do innovation, come along and enjoy the ride. I've been doing this for the last 20, 25 years on the standards world, but I've enjoyed my journey in my professional career for the last 38 years in the world of information and communication technology. So,
all right,
join the fun.
Thank you very much for joining today, Gora Data on New Cyber Frontier.
Great. Thank you, Chris. Appreciate that.
We hope you have enjoyed this episode of New Cyber Frontier. Remember to get involved. Often we think that someone else will handle privacy and security in the virtual world, but you are the only one truly in command of your virtual fate. Join our mailing list so we can keep you informed of breaking news and new releases. If you have an idea, if you have a question that you would like to hear answered, or if you want to get involved with our efforts, reach out to us at newcyberfrontier.com. We also encourage you to visit our sponsors' links, as they are the ones that really make this show possible. I want to thank each of you for supporting the show, and we look forward to seeing you back for the next episode of New Cyber Frontier.